happens if you feel something off with your heart, but you don't have the convenience of a giant nearby medical tent.
Yeah, unfortunately, not all of us do. I spoke with a cardiologist about what signs to look out for and what to do about it. You may feel something off with your heart from time to time.
All different types of irregular heartbeats. Many of them are actually are benign.
Dr. Thomas Hill is a cardiologist at Trinity Health Medical Group in Muskegon. He says there are a few different things you could feel with your heart.
Any evidence of your heart's beating rapidly or irregularly for no reason, say you're just at rest when your heart shouldn't be beating rapidly. Any sort of a skipped kind of a feeling where your heart feels like it's beating hard, maybe people describe it as beating up into your throat.
But what should you do about this? The first question to ask is if you have any other symptoms like shortness of breath, chest pain, or fatigue.
If all you're feeling is the palpitations, but you're otherwise feeling fine, it's probably okay to wait and get in to see your primary care. But if you have any associated symptoms like we talked about before, if you're feeling dizzy or lightheaded or feel like you might pass out, if you're having associated chest pain or tightness or shortness of breath, any of those symptoms should lead you to seek attention immediately in the emergency department.
The most common cause is atrial fibrillation. It's a sensation of heart racing, beating irregularly for a longer period of time. It can come and go and is not life-threatening in itself, but could lead to other health issues.
It's important to make that diagnosis is because atrial fibrillation is associated with a significantly increased risk of stroke.
People over the age of 65 or who have family history of AFib are more at risk. Doctors may also do other testing to rule out underlying heart disease, like an echocardiogram or a stress test.
Always better to err on the side of caution if you have symptoms and make sure you bring those up with your physician.
Now, what about heart monitors like Harbaugh is wearing?
Yeah, so testing could include wearing a heart monitor for a period of time, especially if your heart isn't racing anymore by the time you actually get to the doctor. Also, Dr. Hill says technology like smartwatches, they've come a long way, especially the newer ones can tell if you're in AFib. He actually recommends them to many of his older patients that they get one for monitoring.
Very interesting. Thanks for that.